A lot of the same things that we talked about in terms of the eyes, you will see apply to the face. So part of the aging process of the eyes is that deflationary process. The same is true for the face. So again, as I'll show you, I typically utilize a combination of procedures in order to get the best results with the face. So yes, the obvious thing is, you need a nip and tuck, and that's true. There is usually need for some tightening and skin removal, but in most circumstances, that's not the only thing. That's not all that people need. This is a slide that we showed when we were talking about the eyes. Same thing affects the lower face. There is sagging, there is loss of elasticity, there is loss of volume. As the volume in the upper face goes away, the skin has nowhere to go but sag down. So one thing that I always talk to my patients about is the general contour of a youthful face. A youthful face is more heart-shaped, is fuller on the top half and leaner, narrower on the bottom. As we age, this contour becomes more like that. We lose volume in our temples and our cheeks. And because that volume is not there, then the soft tissue is not being supported. So then it kind of hangs down. So really the deflationary process of aging is true all across the face. So not just the eyes that we just finished covering. We already really talked about the upper face and what things are done to rejuvenate it. Things like a brow lift, upper blepharoplasty, ptosis repair, fat grafting, and laser. For the middle part of the face, that's kind of where the lower eyelid, the fat grafting, but also laser resurfacing, and maybe the upper portion of what a facelift does. And then for the lower portion, that's where, primarily lower face and neck lift, sometimes chin implants, sometimes procedures done to lips to reduce the height of the lip. But again, also fat grafting and also laser resurfacing. So the addition of volume and improvement of skin textural changes really have an effect on the entire face, not just the eyes, but on the entire face. What surgical procedures do we have for the face and neck? One of the most common ones is combining a lower face and neck lift with fat grafting. The surgery helps with that jowling and the neck laxity, but then the fat grafting helps restore some of that volume in the upper face. And again, the volume doesn't need to be dramatic. It can be subtle. We're not trying to make people look like a different person. We're just trying to make them look like themselves maybe, 10 years ago. This is another, patient who I took care of recently. Again, she had lower eyelid bags, squaring of the jaw. You can see with the fat grafting how the volume shifting of her face just almost created a generational change in her youthfulness, so she has that heart-shaped contour. We talked about this in the last talk. Now we're introducing the lower face and neck into the formula. And this is her profile view showing the effect of the neck. She was in her early 50s, I want to say. Yeah, early 50s, like 51, 52. Yeah. So, big difference. Yeah. This woman was in her 60s. She, again, had fat grafting. She had a lower face and neck lift. Now, as you'll see in her profile view, she had a weak chin. Now, you don't really appreciate that here, but we did a chin implant in her because her bone structure was a little bit weak. So we were not going to be able to get as nice of a chin neck angle without extending her bone structure. Okay. So this now kind of brings in the use of implants for facial contouring. I showed you this woman's photos when we were talking about the eyes. So she had her lower eyes and fat grafting, but we also did her lower face and neck lift. Again, very subtle, natural result. This is a pretty difficult neck. I mean, not all necks from a surgeon's perspective are the same. Some people have fairly thin necks and they have some, hanging skin. Some necks like her, there's a lot of work to be done there. There's a lot of tissue, a lot of glands and thickened muscles and things that we have to work on. So even though this result may not seem like it's as impressive as the first one that I showed you, this was a lot more work. Also a fairly common combination, doing a brow lift, a lower face and neck lift, and fat grafting. She has more normal eyebrow position, has a little nicer fat pad to her cheeks, and has a nicer neckline, jawline. Sometimes ptosis is kind of caused by like a slight blink during the picture. So that can be it. Now she had a eyebrow that was a little bit lower. So if you look at her, her eyebrow on the right is more normally positioned than the left. So when we did her brow lift, you can see that the discrepancy is a little bit less. Yeah. And then this is her profile view. She looks like herself, nothing that's too different, but just a better version. The downtime on the lower face and neck lift is generally 2 weeks. 95% of patients at 2 weeks are presentable. And if you go in the clinic and talk to some of my staff, we have an iPad that has photos of, patients at like 1 week if you want to see what they look like, some examples. Generally, people somewhere between 1 to 2 weeks look presentable. It's pretty rare to need more than 2 weeks. As far as how you feel, that kind of downtime, that's more like 3 to 4 days of maybe not being able to do much if you're working from home, just kind of being tired and groggy and maybe needing to take some pain medication. This is a woman who was being kind of proactive. I mean, she wasn't too saggy in her jawline and neck yet, but she wanted to do her eyes. So, she said, well, if I want to do that, let's do everything else. So, we did her eyes and brow and fat grafting and lower face and neck lift. For me, the most common age range for lower face and neck procedures is probably 50 to 55. That's probably, I would say, the sweet spot. So again, here is the, change in her jawline and neck. For men, one of the things that is really important is making sure that they have a strong jawline. Okay, so if the male patient does not have a naturally strong jawline, I typically do recommend a chin implant, which is what we did here. Giving him a little bit of a stronger chin really enables us to get that nicely chiseled jawline. For men, just so you know, the incisions, they start here, are in front of the ear, they go behind the ear, and then they kind of come in the back of the hairline like that. Okay. For women, the incision goes here, 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 and again, behind and back. So the main difference is with men, we keep it all the way in the front. With the women, we break it apart so that the central portion of it is behind this little piece of cartilage. But again, in the office, I can show you close-up photos where you can see the healed incision. So again, this is another combination. She had a brow lift, had a lower blepharoplasty to take care of her bags. She had fat grafting, and you can already see her face is looking more heart-shaped, kind of full here, but narrower here. And she had a lower face and neck lift. Now, she also had a procedure called a lip lift, which we alluded to earlier. A lip lift is a procedure that is ideal for patients who have a great amount of distance between their lip and their nose. So essentially what that procedure does is it removes some of that skin under the nose, brings the lip higher up closer to the nose, and it improves the aesthetics of the mouth. It creates a more balanced aesthetic between the nose, the lips, and the chin. I think the next patient that I'm going to show you also had a lip lift. So again, she had a number of things done. She had a brow lift, upper blepharoplasty, lower blepharoplasty, fat grafting, laser, lip lift, and lower face and neck. And again, you can see that the height here is a little bit less, and it creates a subtle fullness to the lips as well because it kind of rolls the lips up a little bit. When you think of recovery, recoveries occur concurrently. So if you're doing, let's say in this instance, 7 different procedures, if all procedures have a week-long recovery, then in 1 week, you can essentially recover from all of them. Now, if you don't do them together and you break them apart, then you still need that length of recovery. So for most patients who, want to limit their downtime and limit the amount of time they take off work, it makes sense to do it all in one session. Now, my partner who does breast and body work, sometimes we have patients who see both of us, who want to have facial rejuvenation, but they also want to have breast surgery and tummy tucks. And then the number of hours kind of start to get to a point where it's just not safe and not a good idea to put someone under for that long. So for me, I've been doing this for 25 years. So, I know kind of how long it takes me to do things. So the cutoff is 7 hours. If I can do the surgery in 7 hours or less, that's, usually fine. I typically take a 10-minute break in between because my assistants have to change instruments for different parts of the surgery. So there's about a 10-minute downtime, and that's more than enough for me to go take a quick break. So I think this concludes the portion of the talk about the face, but we do have at least 10 minutes for questions if you guys have any questions. Yeah, that's a great question. So the question was, when you do a brow lift, is it possible to actually lower the hairline? And Absolutely. Yes. Yes. So there are effective ways of essentially doing a brow lift where you are removing forehead and bringing the hairline low. In fact, I did that on a patient today. So it's called a hairline lowering forehead lift. Those older techniques of coronal brow lifts, I've not done those in over 20 years. They seemed at the time like they were a good idea because you're hiding the incision up high, but they usually end up resulting in more hair loss than doing things lower down near the hairline. How long does a facelift last, and is it okay for someone to come back and have a second lift? And the answer is the length of time varies from person to person. The average, I'd say, is probably about 10 years, but some patients get more than 12 years out of a lift. Others get 6 to 8 years. There's absolutely nothing wrong with redoing a lift. If anything, second lifts are generally easier because the incisions are already there. And typically, they're just mostly repositioning the deeper tissues. It's not so much about removing skin, but it's about going back to the same incisions and just lifting things upward again. Yeah, we do remove a little bit of skin, but generally not as much. And then again, going back to what we talked about before, second lifts typically involve fat injections again. Second lifts sometimes involve, in the appropriate patient, laser resurfacing and things to improve skin texture. Again, I've been doing this for 25 years, so I have probably had many patients who have done their second or, sometimes third lift. And as long as you do it correctly and, with attention to, detail, you can still get great results. Yeah. Injections do things that surgery doesn't do. There are many patients who get great results from injections after a lift for many, many, many years, but they kind of get to a point where all of a sudden they see that injections are not doing what they did in the first, 6, 8 years after their lift. They're starting to get a little bit too much jowling and kind of heaviness here in their lower face and neck. So yeah, that's exactly kind of when you know that it may be time for a second one. The recovery of a second lift can be the same. Sometimes it can be a little shorter, again, partly because the incisions were already made. Sometimes it just, the body has a bit less trauma if the incisions that are being opened are ones that were already, opened once. But you also have to consider the fact that generally patients are also a decade older. So sometimes the same shock to their system may seem to be a little bit more. So I don't think I've ever done a fourth lift on anyone, but I've done a number of third lifts and, all of them have had great results and I've been very happy. It really depends on the age of the patient, right? So, if you're in your 40s and you're just starting to get a little bit of laxity in your face, really all therapy, thermage, maybe threads are really all that you need. Keep in mind that those treatments don't remove any skin. They're not repositioning tissue. All they're doing is they're building collagen and they're tightening the skin that you have. Their effect is definitely different than surgery. And the older the patient gets, the less likely that they will get an adequate result from just all therapy or thermage. But having said that, I encourage a lot of my facelift patients to actually get all therapy and thermage even after a lift to help maintain their results longer. Because keep in mind that after a lift, if your skin is in good shape, if it has healthy, tight collagen, you're going to enjoy the results of your lift significantly longer than if you don't do anything to stimulate your collagen. So really those treatments are kind of, in a way, I think of them as taking your skin to the gym. You're exercising that collagen, you're stimulating that collagen, and that will only enhance what results you've already gotten from surgery. If a woman in her 70s comes and she needs a lift and she wants to see, Lynn or Rachel to get, all therapy, they'll kind of probably talk her out of it. They say, listen, at your age, this by itself is not going to be doing as much for you. It depends on whether you're talking about the lower face or the upper face. So the upper face, like brow, eyes, mid face, you can do those independently. If jowls are a concern, the jowls and the neck are part of one anatomical unit. So if someone is bothered by their jowls, then by definition, we should be lifting their neck as well. What is the correct vector of lift? And what she's referring to is, the correct vector of lift, which is, what you saw in all those examples that I showed you, is upward. So it's more vertical, more upward than horizontal. So to answer your question, yes, you use some of the same incisions, but you may need to create some extra ones higher up so you can come at the tissues from above. But generally, you can still reuse most of what's there, maybe add some extra towards the top. Well, you guys have been a great crowd, very interactive, great questions. So I think we have a few minutes, or actually, no, I guess it's almost 7:30. Thank you.